This is Dr. Hayden for the OTS 450 OBP Orthopedics class, and I wanted to give you some instructions on the evidence-based intervention technique assignment. If you look through your chapter in the textbook on motor function interventions, you'll see examples of how to decrease pain, edema, improve wound healing, treat scars, increase range of motion, tendon gliding, muscle strength, fine and gross motor coordination, endurance, etc. So you want to find a current evidence-based article, peer-reviewed, to support the use of an intervention technique that's commonly used with upper extremity orthopedic clients. Each of you will locate and post a video in addition to an article of an OT or student demonstrating an appropriate intervention technique. An alternative would be to create a short video of your own, less than 5 minutes, demonstrating an appropriate intervention technique for upper extremity conditions. You will also post the video to the Google Doc before it's been graded. If the video is not acceptable, you'll need to delete the URL and post a second acceptable video. This assignment is worth 4% of your grade, and the student learning outcomes from the syllabus are that it demonstrates evidence-based and occupation-based intervention relevant to orthopedic conditions through analysis and interpretation of client evaluation. It fulfills our ACOT standards by recommending and providing direct interventions and procedures to persons, groups, or populations to enhance their safety, health, and wellness, and performance in occupations. It includes the ability to select and deliver occupations and activities, preparatory methods and tasks, including therapeutic exercise, education and training, and advocacy. This evidence-based article may include a treatment intervention or assessment that would be incorporated in your P2 end of the year annual summative competency. The skills that you'll learn in doing this assignment are to locate and synthesize information from evidence-based and occupation-based practice articles, supporting the use of biomechanical and preparation for occupation or occupational interventions for clients with orthopedic conditions. Under knowledge, the assignment will help you interpret evidence-based and occupation-based practice articles for appropriate assessments and interventions for the orthopedic population. The task is to develop a URL with occupation-based practice orthopedic resources for future use in competencies, fieldwork, and practice. This document will contain biomechanical and occupation-based techniques supported by the evidence-based article. So the grading rubric for this assignment, and I'm assuming it's not going to take a whole lot of your time, maybe an hour, you want to find a peer-reviewed article that supports assessment or treatment intervention based on an upper extremity condition. It has to be a current article, less than 5 years old. You need to identify the type of research, whether it's quantitative or qualitative. You need to explain the level of evidence, and I have included a chart below the grading rubric that has the level of evidence that I want you to use. So indicate which level of evidence the article contains. You want to identify the type of assessment or treatment intervention that the article talks about. You also want to include like a paragraph of the main focal point and 3 subpoints of the article. Explain how the article supports use of that particular technique in orthopedic practice. You want to find a link of a therapist or student performing the treatment technique. As an example, if you find an article on kinesiotaping, then find a 3 to 5 minute video of a occupational therapist or occupational therapy student portraying how to use kinesiotaping with a particular type of orthopedic upper extremity intervention. You want to also post that link. I will create a Google Doc for each section of lab, and you'll want to post that video link on that document. And that is the expectations for your evidence-based intervention technique assignment. Thank you.